Hi, my name is Adam. I'm the pharmacist. I run the stop smoking program here at the pharmacy, and I understand that you've come here because you want to stop smoking.
Yes.
So just before we start, can I just get your name and your date of birth?
My name is Meech,
Each.
and I'm born on the 4th of February,
4th of February
1990.
1990. So, just before we start, I'm going to give you a little bit of background information about this smoking program that we have and a little bit of information about smoking. So, smoking is a significant risk factor for multiple conditions including cardiovascular disease, stroke and lung cancer. And smoking negatively impacts your health overall. So in terms of our program, so we've had a lot of success with patients undertaking this program, and with this program you are 4 times more likely to stop smoking. Do you have any questions about any of that?
No, that sounds good.
So just before we start, I just going to let you know that everything that we're discussing here is confidential and it won't be shared with anyone else outside of our conversation here. And is it okay if I ask you some social history, some family history, and some personal questions?
That's fine. That's fine
Okay.
with me.
So to start off with, how long have you been smoking?
I've been smoking for about 15 years.
Yep. And how much do you smoke exactly?
20 cigarettes a day, a pack.
Okay. And what type of tobacco or nicotine do you use? Is it just cigarettes or anything else?
I use cigarettes, sometimes I use e-cigarettes.
Okay. And what situations do you smoke usually?
So I smoke when I'm driving, when I'm with friends, walking. It's a habit. It's a big habit.
So how does smoking make you feel?
I mean, now I'm just kind of sick of it. It's messed up the taste, my taste buds. I mean, finding it more difficult to breathe, and the smell on my clothes. Yeah, it's quite a big impact.
So, I mean, I want to congratulate you for taking the step in this program. This is a great step forward for your health, and it's quite difficult for a lot of people to stop smoking, as you know. So just to carry on. So how is smoking affecting your life and your relationships in any way? Is it affecting you?
Yeah, so in terms of relationships, the ladies don't really like the smell of cigarettes and clothing and all that. And so I do want to quit because I think that would make things easier.
Have you previously tried to quit smoking in the past?
Yeah, I managed to quit for about 2 weeks.
And how did that go?
It was very difficult. I was using an e-cigarette to help with the cravings. It helped a little bit, but I gave in after 2 weeks because it didn't really fight the urge as much.
And what caused you to relapse during those 2 weeks?
I mean,
The end of those 2
yeah,
weeks?
so for about a week, the e-cigarette was working. I didn't really feel the need to smoke as much, although I had the urge, but afterwards it wasn't doing it for me. I think I needed the cigarette, so I just gave it.
So did you experience any withdrawal symptoms like irritability, dizziness, like?
Definitely, I felt irritability, I felt headache,
Yeah.
I felt stress, I felt agitated. A lot of stress, agitation, tension.
So with this program, so this is a common thing that most people who undertake the program are going to experience once they stop smoking. So you will experience some withdrawal symptoms, and this program will help you to deal with those symptoms and overcome them. So now I'm going to ask you, is it okay if I ask you a bit about your medical history?
Yeah, that's fine. No problem.
Do you have any existing medical condition?
I've got diabetes, type 2.
And are you taking any medications for that?
I take metformin for that.
Do you have any other medical conditions?
No, that's it.
And are you taking any other medications other than metformin?
No, just metformin.
Okay, are you taking any over-the-counter medications?
I mean, sometimes when I've got a headache, I take paracetamol. That's about it, nothing else.
Do you take any herbal remedies at all?
No,
Do you take any injections, creams, eye drops, patches,
no.
anything like that? Okay. So, I'm gonna ask you, so, is it alright if I ask you a little bit about some of your family history?
Yeah.
Do you have anyone any relative or anyone in the family who might have some smoking related medical conditions?
Yeah, my granddad passed away from lung cancer.
Lung cancer. Sorry to hear that. And I'm just gonna ask, do you drink any alcohol? Sorry.
No,
Do you take any recreational drugs?
no.
Okay. So do you have any questions at all about anything I've discussed so far?
No, it's been quite straightforward.
Is there anything you want me to clarify about the program at all?
No, sounds good.
So what I can do for you now, so when would you like to start? When would you like to stop? When would you like your start date to be stopping?
So, anytime, as soon as possible.
Would you like to stop smoking on Wednesday?
We could do Wednesday.
Sure. So what I can do for you now in that case is that there will be upcoming sessions scheduled in the next few weeks that can support you on your journey to quit smoking. And what I can do now is I can show you some of the different types of nicotine replacement products that we have available that can help you quit smoking. Is that okay with you?
Yeah, that's perfect.